welcome to On Call After Hours, where we answer the questions we weren't able to get to during the broadcast portion of our show. We had a bunch of questions. We want all of them answered if we can. Your questions are important. We want to answer as many. So here we go. Is esophageal cancer hereditary?
The answer is likely not. We don't have a strong familial predisposition. Usually acid reflux can be a substantial risk factor in certain individuals. Smoking is the other one. Family history, not as important.
Not as important, although I have a Chinese patient who saw me today, and his mother and father both had esophageal
and that's
cancer.
not to be taken lightly, but I don't think it's near as common like, for example, breast or colon cancer.
Right.
Agree.
Green tea, would you, if you had esophageal cancer in your family, would you drink green tea?
I would promote a diet and a lot of antioxidants, so fresh fruits and vegetables. Green tea probably won't hurt.
No.
What can we do about esophageal reflux? How do we prevent reflux esophagitis?
Weight is a big one, and how you eat. So it's lifestyle modifications. If you don't want to take a pill,
Yes.
modify your diet and watch your weight.
It's the harder thing to do, but it's the best thing to do.
Elevate the head of the bed,
Right.
because a lot of
12
it's
inches.
Don't eat for 3 to 4 hours before bedtime and laying down. Overweight is really the significant. High fatty foods.
Yes.
Right. Okay. Are there any dangerous severe side effects of omeprazole or Prilosec? Also, can reflux initiate an asthma attack? Good questions. Prilosec, is it, people are on it for years and years and years. Is there side effect?
Yes, there are. I mean, we're learning osteoporosis, for example, thinning of the bones. There's been some reports that it might promote an intestinal infection called C. difficile. So it still, I think, by and large, when used judiciously, is a relatively benign drug, but we cannot be lulled into a sense of security. There are side effects that we're seeing when used long term.
And can you see asthma? Yes.
Yeah.
If you have reflux coming up, just spraying, it's like a nozzle spraying your vocal cords. Yes, acid can contribute to reflux and cough.
So people get
Or if you
cough and
cough,
asthma
yes,
from the
yes.
reflux.
Correct.
Are there any dangerous severe, are there risks to colonoscopy? We've talked about that.
Yes.
Constant cough with reflux, what kind of testing can you do, should you do, and
Well, I think one of the easiest is try a proton pump inhibitor, a medication like Prilosec, and then we move into looking, is this truly acid related or not? And so you can actually test acid levels, do a pH study, be it through a tube down your nose for 24 hours, or we clip a sensor into the lining of the esophagus, measuring acid, and then we correlate that with symptoms.
so you give that to people who really fail everything else?
Exactly.
Okay.
But a good trial of high-dose proton pump inhibitors like Prilosec is a good
Prilosec
first
or
start.
Protonix, do you
Yep.
prefer any particular brand?
No,
You know, your omeprazole is generic and it's cheaper.
whatever's cheapest.
Okay, stool softener every day has been, has a movement every day, still very doesn't have a bowel movement every day though, still very constipated, taking tramadol for pain. Could this affect constipation?
Absolutely.
So tramadol can cause a constipation.
Yeah, absolutely.
Stool softener is a good choice though, don't you think?
Right, so what is normal? 3 bowel movements per day to
Yes,
3
good
per
point.
week. But it's more so feeling as though you empty out completely and you don't have to sit and strain and spend a lot of time in the bathroom. So,
Three a day to 3 a week.
Yeah,
yep,
you do
that's
not
normal.
have to have a bowel movement
Not
every
like
day.
what Dr. Oz says, yeah? So,
You know, if the patient is otherwise is doing well, not to worry.
I tell people to avoid stimulant laxatives. I think osmotic laxatives like stool softener, milk of magnesia.
Absolutely.
I prefer Miralax.
Miralax
the
is a
best.
wonderful addition
best.
to our.
It's been a good
Our
thing,
military,
hasn't it?
yeah. Very
How
safe.
about the new kind of expensive drugs?
They're expensive, and the bottom line is, in the majority of patients, you don't need it. Despite what the marketing says, you don't need it. We've got very good alternatives.
There's sometimes, though, you do need it. I mean,
Absolutely, in that
it works.
Yep,
Yeah,
it can.
but the key point is not to jump to that as your initial drug.
What will irritable bowel syndrome go away on its own?
half of people with proper treatment in 1 year will have no more symptoms.
And proper treatment is?
Diet and sometimes medications.
The diet is no milk,
We have,
high fiber.
and there's a FODMAPs
FODMAP.
diet, a low fermentable food item diet, so a list of foods to avoid, certain grains, certain milk products, certain fruits and vegetables, the cauliflower, the broccoli.
So you look it up where?
FODMAPs, Google it.
Yeah.
How do you-
FODMAPS, FODMAPs.
FODMAP.
FODMAP.
Mm-hmm.
84-year-old has diverticulitis. Do you not need a colonoscopy after some age? She's 84. for?
That's a good question because we see this all the time. Somebody's had an attack of diverticulitis. Why would you consider a colonoscopy? The real reason to do that is you want to rule out that uncommon cause of colon cancer. So if this patient has had a screening colonoscopy in the last 4 to 5 years, I would make the argument and say no.
Yeah.
And you don't want to go in there too soon because you could create a bigger problem.
Right. Well, it's a dangerous area with all those
And you're putting
diverticulitis.
air in and so forth.
How important is the IgG test if it's 530? Is that a risk to your immune system? IgG 530 IgG test. Maybe it's the TTG antibody.
Either that or they're just talking about a random IgG test
Globulin,
for
yeah,
immunoglobulins,
yeah.
which is very nonspecific.
Right.
Something non-Hodgkin's lymphoma, Rituxan treatment, IgG test for 87-year-old. What can an 87-year-old woman do about her constant gas? Do you think that some people really do have more gas?
Yes, absolutely. But diet, so starting with a FODMAPs diet, watch what you're eating, making sure you are emptying out completely as well, so you're not constipated. I think those are basics.
And then air swallowers. Some people swallow air if you can get them to catch themselves.
Yeah, constantly, so that's behavior change.
Although I did hear one study that showed that girls pass as much gas as guys did, and I tell you, it was a surprise to me. Bad joke. Here is a story. Please talk about lymphocytic colitis.
Yeah, lymphocytic colitis, another term is microscopic colitis. And this is a situation where patients will come in and have watery diarrhea, and you've tested them upside down and sideways for different infections. Everything's normal. You do a colonoscopy, it looks normal. The colon looks normal, but you get biopsies. And when you look at those biopsies under the microscope, you can see one of two things: an increased amount of lymphocytes in the subepithelial layer microscopically, and that can cause a watery diarrhea. The other thing you might see is a layer of collagen, a fibrous substance band underneath the subepithelial layer. Both of those, interestingly, are treatable. We start first with standard treatments of fiber, perhaps an antiperistaltic such as Imodium, but if all that fails, we have an excellent drug that budesonide, which is a steroid-like medication, but you don't get the steroid side effects, and it can be very effective in controlling and treating the diarrhea.
And lymphocytic colitis is associated with celiac
Yes,
disease,
thank
so
you. Very
think
good,
about
Christine.
celiac as well.
Yes, think of celiac when you see it.
How about eosinophilic esophagitis, very quickly?
It seems to be everywhere. So a young man who says, I eat and the food gets stuck, these are the individuals to think about it in. So allergic type reaction of the esophagus, sometimes associated with certain food items. Start with treatment. It's a biopsy. You look underneath the microscope for these eosinophils. You would start with standard treatment of a Prilosec, omeprazole, but sometimes a topical type medication can help clear up this extra
You swallow your
inflammation.
inhaler. that type of thing.
Exactly.
And the key is the doctor has to think about it. If they're having trouble swallowing and you don't see a stricture, you have to think of that diagnosis.
What are the chances hiatal hernia occur again? First one was about 10 years ago.
And obviously had it surgically repaired, is that?
Well, I don't know.
Because,
maybe-
I will tell you, we've seen with surgical repairs, a lot of them will slip. And you can have recurrent hernias within 5 years, up to 50%.
So they end up eventually on omeprazole anyway.
In 10 years, half will be back on.
Right.
Right. And but do you repair them? Do you believe in the repair?
Challenging surgery, and you really have to convince the patient.
Careful patient selection is key.
All right. Sioux City, Iowa. Caller has lifelong constipation till a year ago, suddenly has loose bowels movement, no history of cancer in the family. It's a serious symptom. I'd say colonoscopy.
Yeah,
A dramatic change in bowel habit like that, have it evaluated.
a warning sign.
And it could be one of those things we've discussed earlier,
Correct.
too. A lot of reasons. Does using a stool softener every day have a bad effect on my colon?
No.
No.
No problem with stool softener.
None.
I sent one person, I couldn't get them fixed, and they were worried, and I sent them to the Mayo Clinic. I think this is where they wanted to go. And they came back on 3 stool softeners twice a day,
Yeah. solved
the problem.
Yep.
I think if you give them flaxseed and 3 stool softeners twice a day, a rock would have a bowel movement. Hello from South Dakota Senator, likes the show, watch enjoying in oil field related, doing great. Watched. So, thanks so much. Is there any benefit to using detox diet that's popular in magazines and online? Detox diet. Do you have any idea what a detox diet is?
No, I would assume it's some type of elimination diet, taking out sugars, taking out wheat, but probably no major benefit. A lot of people have certain food intolerances. It probably won't hurt.
One has to be careful. There's a lot of marketing out there, and just one has to be careful.
There's
Run
so
it by your provider
Right.
if you have a question.
So your diet for irritable bowel syndrome is again what?
FODMAP.
Great word. Word of the night, Rick. Word of the night. FODMAP.
Yeah.
Ongoing problems, belching, diarrhea, mostly smelling worse at night. What is the cause of this smelly, bad, odorous?
Whenever I hear of foul, smelling, bad, I mean, obviously it all can be not good smelling. But if it's excessively foul, you want to think about malabsorption. When we do not absorb our fat, it can be a very foul-smelling stool,
So what-
and you got to consider that.
Well, what causes fatty
there-
malabsorption?
There's two major
Celiac?
things. We talked about celiac in any condition of the small bowel, but the other one is pancreatic disease, where the pancreas becomes insufficient. And if the pancreas can't produce an enzyme called lipase, you will not absorb fat well, and the fats will cause that greasy-looking bowel movement, and it will be extraordinarily foul-smelling.
Would you do an ERCP, which is, or would you do a CAT scan?
You can,
or
actually, you can start with a simple stool test to see if there's excess fat in there. If that's the case, then the first step is to do a good CT or an MRI without the radiation, because you can see calcification of the pancreas, which is an indicator of possible chronic
But
inflammation.
I know of no lab person who likes to do stool for fat.
Well, and especially if you get a 3-day study for fat.
Those
They
are
don't
the,
like
those
that
are the
either.
bad ones, and I can never imagine those people doing those tests. But now we have other tests where you don't have to quite do that. You can do just a spot stool test for what we call qualitative fat to get, or there's other ones where you can check certain enzymes that are leaked into the stool.
all right.
So better.
Caller wonders if she can become immune to the effects of Zantac, Prilosec, and also uses one for a while and then switches back and forth. Not that exciting. What about using H2 blockers? Things like
Well, they're definitely so your Pepcid, your Zantac,
Your
your
Pepcid,
cimetidine,
yeah,
so
cimetidine.
they're making a comeback, especially in the hospital setting where we want to avoid that C. diff, the hospitalized diarrheal infection.
and it's a faster
Yes,
acting.
it works quickly, perhaps not as many side effects. If it works for you for that intermittent heartburn, sure.
Go
Yeah,
for it.
I like as needed H2 blockers like
they're cheap,
Pepcid,
yeah.
and they're cheap
And they're
over the
cheap,
counter.
and they're safe.
Yeah, get the generic version, not the Pepcid.
Absolutely.
Correct.
Not the
Much
Zantac,
cheaper,
get
and
the
they work
Ranitidine.
exactly
Yep.
the same.
Please talk about SIBO, small intestinal bacterial overgrowth in Canada. What are the symptoms and how can they be tested or treated?
Well,
That small intestinal bacterial
small
overgrowth.
intestinal bacterial overgrowth. Basically, what that is an overgrowth of our normal bacteria of the small bowel. Risk factors for that: if you have a slow-moving small bowel, if you've had intestinal surgery of some type, that bowel will not move as well. It allows for overgrowth of bacteria. Classic symptoms: excessive bloating and diarrhea. Treatment is antibiotics. But again, as you mentioned on the show earlier, you don't just want to randomly throw antibiotics at this. We can actually do a breath test to see if there's too much bacteria in the small bowel. You can go down with an endoscope and aspirate fluid from the small bowel and have it cultured to see if there's bacteria in there.
Latest treatment for biliary cirrhosis.
Primary biliary cirrhosis. The standard treatment for years has been ursodeoxycholic acid. I recently saw a study that looks promising. Mayo Clinic is one of the world experts in primary biliary cirrhosis, where they're looking at a second new medication in conjunction with urso, and those patients did better.
So urso and
I cannot remember the name of the medication. It's an experimental one. It's not reached prime time yet, but
Okay.
the investigation looks promising.
I've been on GERD medicine for 15 years. Can you discuss protocol to get off of GERD? So people get stuck on it. Sometimes they're on omeprazole, or even if they're on the H2 blockers, right? They had heartburn. It made them better. GERD is gastroesophageal reflux disease, so it's reflux esophagitis. There's some data to say that even if you didn't need it in the first place, if you stop it abruptly, you can have rebound hyperacidity.
Yep. So you just have to somewhat taper yourself off of that medication and be prepared for that, and know that during the first 1 to 2 weeks when you're coming off that medication, you might have to use a few more Tums here and there, but try to wean yourself off of that medicine.
All right. Caller has gastroparesis, has had symptoms of gallbladder attack several times in the past. Is delay of symptoms secondary to gastroparesis?
Well, gastroparesis basically is a delay of the ability of the stomach to empty properly. And the key there is sorting out, okay, so you do a study that suggests that the stomach is emptying slower than usual. The question is that the cause of the symptoms? And that can mimic gallbladder symptoms to some degree. And the problem with gastroparesis is we don't have a lot of good, effective medications. Reglan or metoclopramide was the classic, but that drug is dangerous, particularly in older individuals. And you want to use it very sparingly, very quickly.
Hurt themselves.
Absolutely.
I've had internal rectal pain with chronic constipation for months. I thought I could have hemorrhoids, so I tried over-the-counter medicines. After no alleviation of symptoms, I went to my primary care doctor, didn't find any hemorrhoids. It was suggested I have a CT scan, but that seems like overkill. The physician's rationale was to rule out abscess. Any thoughts?
If the pain is with defecation, the other thing this could be is called an anal fissure. And that's the common thing that I see that's missed. Because you really have to inspect that perianal area carefully. If you're having constipation, you pass a larger hard stool, it causes a tear, a rip, and it hurts badly. And that is very treatable condition. So, you know, a CT may be overkill. If there's no fever, no white count, I would at first say let's get a very good perianal examination before you jump to the next step.
Do you use nitroglycerin for anal fissures?
Sure. That and diltiazem 2% as well.
Topical, but those are kind of spendy. You can
Yes,
get
they
them
are.
at the, you can have them made
You can have them
at
compounded cheaper
Yeah.
than
compound
Yeah,
pharmacy.
and use that, and then in combination with Miralax to keep
Yep,
those
keep
stools
the
soft.
stools
And
soft.
it's and what the nitroglycerin does is it relaxes that anal sphincter so
So it
that
doesn't
it's not
go
so
spasm.
tight.
Yeah.
Is it safe to have a colonoscopy when a person has diverticulitis? She has a history of intestinal abscesses. One doctor said she shouldn't have another colonoscopy.
I would be careful. You certainly don't want to do a colonoscopy around the time of the attack of acute diverticulitis because that bowel wall is very tenuous. If you go in there, put air in there, you could put another hole in the
Blow
colon.
it out.
Absolutely.
Caller has chronic diarrhea, doesn't have celiac disease, has tried diet elimination without success. What can she do to decrease diarrhea?
This may be a diarrhea predominant irritable bowel syndrome, which we talked about earlier. Bile acid binders, such as Questran, is one thought. I've had success with that in
I have
patients
too.
with chronic diarrhea.
Absolutely.
And don't underestimate the importance of scheduled Imodium. That can be very beneficial in these patients. The problem is they'll take it as read, as needed. I'll put them on it maybe twice a day or 3 times a day. It's amazing how many times that'll
Before
work.
you go out to church, before
Yes,
you go out
exactly. When you're going to drive and you don't want to have to stop at the restaurant. Yeah.
because it's safe
Yeah.
to take.
75-year-old prepped for colonoscopy, unable to proceed, secondary to incomplete emptying. Now getting ready for her second colonoscopy, how will insurance handle this? I don't know. That's an insurance question. That's a good thing.
That is an insurance question, but I think the key there is that the physician doing the procedure has to document
Right.
why it was unsuccessful and why it's needed again. And I think the physicians need to make the calls to this insurance company and say, look, and be an advocate for the patient.
And they're usually good. They are.
And they'll respond to that, but you just have to document it.
And you know what? Sometimes people, I have people that they just don't clean out.
People have slow
They're good
transit.
people. They follow
and they
exactly.
follow
And
the
they're so
directions.
heartbroken. They say, yes, I did everything you said. Some people just have a slow
And then
colon.
there are people who are just clean as a whistle.
Yeah.
Osteoporosis, pressing on internal organs. What is a way to treat this? So bending over osteoporosis, thoracic kyphosis, bend.
It's a mechanical problem, and there's no good answer with regard
There is
to
no
the
good
guy.
answer, is there?
No.
You can't straighten them either.
No, not without breaking something.
45-year-old Aberdeen, stabbing pain in the left periumbilical area for over a year. Has been examined but can't figure out the cause. Recently has had loose stools. Family history of diverticulitis. Any ideas? Sounds like diverticulitis to me.
The other thing I would be concerned about is you at least want to consider small bowel Crohn's disease. Anytime people point around the umbilicus, I think of the forgotten organ of the gut, and that's the small bowel.
intestine.
Yeah, I would agree. And that might be the time to say, okay, a CAT scan.
Yeah,
Yeah.
This
yeah.
might be the
With
time.
specific look at that small
Yep.
intestine, I think it'd be good.
All right. Well, we answered 1,000 million questions. Thank you both for it was wonderful.
Round, yeah.
Thank you so much. Thank you for joining us on our website. We appreciate all of your questions and the opportunity to answer them. Until next time, stay healthy out there, people.